This glass table, if we hit it, it will break easily. But this glass wooden table, if we hit it, it will not break easily. And that is because the wood will act like a shock absorber, and so that the glass will not break easily. The exact same idea is applied here in our teeth. The enamel is a very hard but brittle material, so that it needs something that absorbs the shocks or the occlusal forces that are applied to it, and that is the function of the dentin. The exact same thing is also applied when the tooth is destroyed by caries, trauma, or anything else. We should restore the enamel and the dentin beneath it. The enamel is restored with the amalgam restorations or composite restorations, but the dentin must be replaced with something that should act like a shock absorber, exactly like it. And that is the thing that we call it in dentistry as the base. Bases primarily function like the dentin in their shock absorption, preventing the composite restorations or the amalgam restorations from breakage, and specifically the amalgam restorations, because sometimes the composite restorations are elastic enough to withstand the forces by themselves, but specifically the amalgam restoration is also hard and brittle like enamel, so that it needs like a must the dentin beneath it or something that replaces the function of the dentin, which is the base. The base have another characteristics, which are thermal insulation, electrical insulation, because amalgam is made from highly conductive materials like copper and silver, which are highly conductive to electricity, so that there might be some galvanic forces between teeth or um, restorations leading to the formation of electrical currents, so that the base must provide electrical insulation, and also it will provide a chemical insulation, and also it will provide a biological insulation from the bacteria that should not go to the pulp, so that the base is primarily a thing that will replace the dentin and its shock absorption function, and also they act like chemical, biological, and physical insulators. Bases differ from material to material, from company to company, but in general there are four types. They are the most commonly used dental bases. The zinc phosphate base or cement, which is usually used with amalgams, the glass ionomer, and the resin modified glass ionomer cements or bases, which are used with composites mostly, and they can also be used with the amalgams. The zinc oxide eugenol, which is usually used in the treatment of the primary teeth, and finally the polycarboxylate cements. These are the mostly used bases or cements, as we also call them, not just bases, but we call them as bases also. But what if we are so close to the pulp? In this case, the bases will not be enough, because we are not only replacing the dentin, but we should replace the dentin with a material that is biocompatible to the pulp, because it will be either so close to the pulp like in the left picture, or it will be in direct contact with the pulp like in the right picture when there is a pinpoint exposure. On the left picture, when we are so close to the pulp and the pulp is shiny, we call it as shiny pulp. In this case, we will put a material that will induce the formation of a secondary dentin in this place and form a dentinal bridge. And the same is also applied to the right picture. We will put that material, and that material will make the dentinal bridge, insulating and isolating the pulpal tissues from the other things. When we do this in the left picture, it is called as indirect pulp capping procedure, because we are capping the pulp, but indirectly, because there is some dentin remained in that area. But if we are in direct contact with the pulpal tissues and we are covering or capping it directly, it is called as a direct pulp capping procedures. That material is called as a liner. Liners in general include the varnishes that are used with the amalgams, but in this case, when we have deep cavities so close to the pulp, the liner is called as calcium hydroxide or dical, and the newly produced MTA is very good and very successful. So that these are the liners, the calcium hydroxide and MTA. They are used to uh, act as an insulators between the restoration and the base and the pulpal tissues on the other hand. Thank you for improving yourself by listening to this presentation. Always try to know, spread knowledge, and construct the world. Be kind to one another, and that is for the greatest benefit to the humankind.